Thank you so much. Good morning, everyone. I'm very pleased to join this meeting today on behalf of Professor Ricciardi, who is the chair of the Mission Board on Vaccination Europe, of which I'm member too, in my role of national expert in vaccination strategies and policies, but also representatives of the European Public Health Association. And I'm pleased that other members are joining also today. And the Mission Board on Vaccination in Europe has been established in 2023, and it brings together experts from 13 countries and also representatives from non-institutional European organizations, including Vaccines Europe. We try to identify achievable but ambitious actions that need to be put in place to strengthen immunization systems across Europe, because vaccination can improve population health, avoiding preventable diseases, but also save money for the health systems, lightening the burden for health services, but also the society at all, because healthy people are also independent, active and productive people. The Mission Board on Vaccination in Europe has released last year a report that is built on 4 pillars. The first one is evidence and data generation. The second one is about beliefs, perception and confidence in vaccination. The third one is about citizen access to vaccination. And the last one is about convergence and alignment. We issued several recommendations on each of these pillars. For example, we called for the production of new data for having a better overview of the burden of preventable diseases, mostly in adults and elderly, for the first pillar. For the second pillar, we ask for the production of toolkit that can be adapted across Europe to increase the awareness about the benefits of vaccination in both healthcare practitioners and the population. For citizen access, we really call for the application of a standardized tool to assess and appraise vaccines in order to make possible to have an equitable access to vaccination, also extending vaccination settings. And in respect to the last point, we called for a unique calendar across Europe to strengthen vaccination, in particular in adults and elderly, that is in line with the interest group initiatives today. And today it's a very relevant and important opportunity to start working together. And in this respect, I would like to focus on 2 aspects that, in my opinion, are really relevant to make it possible to translate these recommendations into action. The first one is commitment. The second one is fundings. Commitment from institutions, that is quite important, and that is built on reciprocal trust and also on reciprocal collaboration. So it's nice today to start working on collaborating together, the scientific community, the decision makers, but also all the stakeholders that need to be involved in doing that. It's possible. The second one is fundings, because most of the recommendations that we issued indeed require funds, because we need people engaged in planning projects, carrying out them, and producing data and evidence that we need to better understand the burden of disease, to better understand the full value of vaccines and vaccination, and also to monitor vaccination strategies and policies that are in place. And we need also infrastructures, new infrastructures, because some data are really missing today. So we need the way and the processes to get it. And that's it for me. And I thank you for listening, and I'm thrilled to join the panel session now.